If you've suffered Achilles tendonitis, you know how painful it is. We want to show you some exercises that you can do to help get you over it before this becomes something that keeps you out of sports and exercise for months. I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, here with my friend and physical therapist from Made to Move Physical Therapy, Yves Gigi. Now, Achilles tendonitis, usually not related to a specific event, but a little bit of wear and tear over time, essentially overuse. You see it in runners, you see it in sprinters, maybe it's a running sport like soccer or tennis. It can be really aggravating, this pain kind of in your Achilles. Sometimes you can point with one finger and show exactly where it hurts. Want to get over it really quickly because like we've talked about with some of the other injuries that we've done in our videos, if you just leave it alone, it starts to get worse and worse, and then you really struggle to exercise at all. So let's talk about some ways to try to get over it.
Yeah, Achilles tendonitis can definitely be tough, right? So the first thing that we want to focus on is getting motion back in that ankle joint and through the heel, right? Because usually heel pain, right? That's usually where patients get it. So we're going to get a box. We can also use a chair at our home and just a little bit of weight, nothing crazy heavy. We're actually going to put our foot up there. So we're going to pretend that the left side, that is the Achilles that's feeling a little bad. So up. We're going to put this on top of our knee. Good. Don't want that to hurt the knee or anything like that.
And where am I on this leg? Does it really matter?
Yeah, just as long as you feel balanced. That's the key, obviously. Okay. So once we're here, the really important part is to keep that heel flat on the box or on the table. And you actually want to push your knee towards me. And if you're doing this right, you'll feel a little bit of a stretch, maybe a little bit of discomfort through that Achilles or in that heel area. And you're going to just go easy, gentle, rocking back and forth. I really like this because there's a lot of people now into this dynamic mobility stuff, and it can be a very useful tool.
Well, and the other thing with the Achilles is it's surrounded by a sheath that can get irritated, so you're helping that tendon sort of slide in the sheath a little more with a little less friction.
Yeah.
So that's actually a great point.
Yeah, I mean, just as you said, like rest usually isn't the prescription here. Usually the prescription is to slowly increase your activity over time so that tendon can start to adapt and get a little bit stronger. Cool. Feeling all right?
That's really good. I like that as a ankle mobility exercise.
Oh,
I like
absolutely.
That a lot.
Yeah. Okay. So the last one is just simple calf raises, right? So the activity you're doing, you're running, you're jumping, you're cutting, that's when that heel starts to hurt. So we want to start building strength back very, very slowly. And we both know that slow, eccentric loads are typically the best thing to do for these exercises. So we're going to do a simple calf raise. Okay. So let's say this is the right side. No, absolutely. And we're going to come up on our toes. Usually you're going to have something to hold on to. We're going to really challenge Dr. Geyer.
And we're just doing a single leg.
Yep, single leg. Well, we could do double leg and maybe just touch, but you're going to come up onto the toes and slowly back down.
Balance is not my skill here.
And you want to go real slow, a tempo of like 1, 2, 3, and 1, 2, 3 down.
I can do the slow up.
Yeah.
2, 3.
Yeah, harder than it looks. Give it a try. You'll find out pretty quick. So yeah, doing slow tempo exercises is what's going to be the best prescription.
Probably would be helpful, like if you had a wall near you just for the balance so that you can actually focus on the strength and motion and not the balance part of this like I'm making look so hard.
Yeah, that's a really good point because the load and the effort should be on that Achilles tendon, not necessarily working on balance. We'll do that in another video.
Yeah, and it's really important because this is one of these diagnoses, like we've done patellar tendonitis and a few others. Rest helps. Maybe you back off of running, for a period of time, do some other things. That's all great. But a lot of times with Achilles tendonitis, if you talk to patients that have had it for 6 months or a year, it's not that it gets worse, it just lingers and lingers and lingers. So if you can get to this early and really start doing this stuff before it becomes like a full-blown area of degeneration in the tendon, your recovery will come about so much faster. So some of these simple exercises that Yves shows us, really important. If you want more information from Yves, all sorts of great physical therapy and injury prevention information, check out his social media sites in the description below this video. Check out our other injury exercise videos. Lots of great ways to get you over your injury. And we look forward to seeing you in our next video.